Hospitals, emergency rooms, and even urgent cares are busy places these days. A steady increase in respiratory illnesses, including the flu, has people needing medical help.
All right, Ohio is in the very high category of this too, according to the CDC. Now, that's a color code of purple, and other states have it too, as you can see around us. Kentucky, even Tennessee. Pennsylvania's colored red, which is high activity. You also notice that this represents activity from about 10 days ago. And people aren't just getting sick with the virus. Many are ending up in the hospital. Nearly 20,000 people across the country were admitted with flu last week, according to the CDC. First News reporter Kristen McFarland is live tonight in Austintown with our top story.
Dr. James Shina with Steward Medical Group says outpatient care is bombarded with phone calls every day about respiratory symptoms ranging from a runny nose and chills to high fever and chest pain. Dr. Shina connects an increase in sick patients to the elimination of social distancing and mask mandates.
Now that we're out in the open, we're back to trying to live a normal life. Now it's just kind of exploded and hitting us pretty hard.
Steward Medical Group says influenza numbers are extremely high right now. RSV has also ramped up and is even affecting older adults.
And we haven't seen an influenza surge like this in probably since H1N1 first hit, maybe almost a decade ago.
Dr. Shina explains all hospitals are experiencing an increase in patient numbers, making it difficult to treat every patient effectively.
Try to avoid the inappropriate use, I guess, of emergency rooms because they're just as understaffed as everybody else, and they're busy with some legitimate emergencies.
Most people with the flu or RSV experience only mild symptoms like a runny nose, cough, or tiredness. But if your symptoms get worse, head to the hospital.
We want to reserve the emergency room visits for those, like the chest pains, the shortness of breath, passing out, things like that. You want to get evaluated, ASAP.
Now, for mild symptoms, Dr. Shina encourages you to contact your primary care doctor or urgent care, and it is effective to treat colds and flus at home through hydration, rest, and over-the-counter medicine. This is the best way to stay healthy this winter and avoid that hospital overload. Live in Austintown, Kristen McFarland, WKBN 27 First News.